Just beneath the skin of the back lies a remarkable set of muscles that are arranged in groups or layers. And today, I want to talk about a very special group of muscles that tie the arm and the shoulder to the spine. What's up, folks? Welcome back to Neurosketch with Dr. Kenny. Welcome to the discussion of muscles that make a bridge between the spine and the arm, the muscles that transform power from the spine to the arm. Before we dive into our focus, let's have a little recap over here. So, muscles of the back are arranged in groups, in different groups. But for convenience, we're going to divide them into two groups. So we have a superficial group of muscles that we call the extrinsic back muscles. Remember, this is the back. So the back has got something. The back is made up of the axioskeleton. Okay, the axioskeleton. So the muscles that do not attach within the axioskeleton are known as extrinsic muscles of the back. So these extrinsic muscles are coming from the appendicular skeleton. Remember, this is the scapula, which forms a part of appendicular skeleton. This is the humerus, also forms a part of appendicular skeleton. So we divide them into two. So we have also intrinsic muscles of the back. These are the muscles of the back proper. They originating from the back and they are inserting into the back. They are originating from the axioskeleton and they are getting inserted into the axioskeleton. The extrinsic back muscles are originating from the back, but they're going to insert to the appendicular skeleton. They are originating from the axioskeleton and they are inserting into the appendicular skeleton. So, because they are inserting into appendicular skeleton, one among the obvious function is to make the movement of the upper limb, But of course, some of the muscles they are accessory muscles of respiration. We're not going to talk anything about respiration at this time because we don't know the mechanism of respiration. But I promise you, sometimes later we talk about this respiratory function. But the extrinsic muscles of the back, they control the spine. So the movement of the vertebral column and the spine is made by these intrinsic back muscles. So the intrinsic back muscles, they maintain posture and also the movement of the spine or the vertebral column. So our focus of discussion today is to discuss about the extrinsic back muscles. But we're not going to discuss all of the extrinsic back muscles. We have also divide them into two groups. So we have the superficial extrinsic back muscles, and this is the group of muscles that will help to move the upper limb. And of course, we've got an intermediate and extrinsic back muscles, but this group is for it has the muscles that help in respiration. So they are accessory muscles of respiration, the accessory respiratory muscles. Alright, so our focus of discussion today now is superficial extrinsic back muscles. But these superficial extrinsic back muscles, they are also called the posterior axio-appendicular muscles. Relax. It is posterior axio-appendicular. So these are the axio-appendicular muscles, but from the posterior side. So they are connecting the axioskeleton to the appendicular skeleton to the axioskeleton. Appendicular skeleton to the axioskeleton. But because they are originating from the back. Listen, because they are originating from the back, from the spine, the axioskeleton, and they are inserting into the appendicular skeleton, which also form the part of the shoulder region. These muscles are also known as they are extrinsic shoulder muscles. Extrinsic shoulder muscles. Don't confuse. So they are extrinsic shoulder muscles, or they are also known as the posterior axio-appendicular muscles. We're going to discuss about the anterior axio-appendicular muscles sometimes later, so don't confuse. We're going to discuss also about the intrinsic shoulder muscles sometimes later. Don't confuse. This is just a simple orientation of muscles of the scapular region, muscles of the scapular region. So as we have said, these muscles, these are superficial extrinsic back muscles, which are also known as the posterior axio-appendicular muscles. They are moving the upper limb. They are moving the upper limb by moving the scapula, and of course the humerus, the scapula and the humerus. And I think now you guys have already gone through the scapular discussion and the humerus. Otherwise, it's going to be difficult for you to understand this session. So you can just pause this video and go back, watch the scapula and the humerus, and then you come and watch this one. All right. So the superficial extrinsic back muscles, which is also known as the posterior axio-appendicular muscles or the extrinsic shoulder muscles, are divided into two groups. We have the muscles that are very, very superficial. In this superficial group, there are muscles which are superficial. So we have these trapezius, and the latissimus. Dorsi muscle are superficial muscles, but when you are dissecting, you flap it away, you flap the trapezius away, you will see other muscles that are deep within trapezius muscle. So these are the levator scapulae, the rhomboid minor, and the rhomboid major muscle. So we have also divided this muscle into two groups. They will divide these muscles into two groups: the superficial and the deep axio-appendicular muscles. Alright, so we're going to discuss each one in turn, and we're starting with the superficial group. The superficial group has got two muscles: the trapezius and the latissimus dorsi muscle. So this is trapezius, and the trapezius, it has the shape of trapezium. The shape of trapezium that defines the shape of this muscle, the name of this muscle actually. All right, so actually we have two triangular muscles. These are the two triangular muscles that they join together to form a trapezoid muscle, the trapezium-like muscle, which is now a diamond shaped, as you can see, a diamond shaped trapezius. So this is the most superficial muscle of the back, as we've seen in the groups. And if you pay much attention, you will see that the fibers, the fibers or the fascicles in this trapezius, they are pointing into different directions. So we have the fibers that are moving in this direction, and of course the fibers that are moving in this direction. So this divides the scapula, the trapezius, into three parts, or three groups of the fibers. So we have these, we call them the ascending fibers. These are the ascending fibers. We have these called the intermediate fibers, or the intermediate part of the trapezius, and of course the descending part, of the trapezius muscle, the defending part of the trapezius muscle. So let's discuss about the region of this muscle. So this muscle has got a wide range of origin. It has got a wide range of origin. So it starts from the superior neutral line. So we have the superior neutral line here, the external occipital protuberance, the neutral ligament, and the spinous process from C7 to T12. C7 to T12 is very wide. You see, it ranges from all these all the way from this region to the T12 spinal vertebrae. T12 spinal vertebrae, the spinous process of this of the those vertebral bodies. All right, so that's the region. Let's go into insertion. You see, as I've told you, the scapula, the trapezius has got like 3 sets of fibers, 3 sets of fibers, but don't worry about it. All right, so the trapezius is going to insert on the spinous process of the scapula. The spinous, a little bit above, a little bit superior border of the spinous process of the superior border of the spinous process of the scapula. The medial part, the medial anterior part, the inner part of the acromion process. I mean, remember, you should go back and watch the video on the scapula, and of course the lateral third of the clavicle, So this is from posterior view. On the anterior view, you will see that the part of this bluish part here, this bluish part is where the trapezius insert. This bluish part. So the acromion process and the lateral third of the clavicle, the lateral third of the clavicle. So what's the insertion of the scapula? Insertion of the trapezius. It inserts on the superior border of the spinous process of the scapula, the acromion process, and the lateral third of the clavicle, So let's talk about the action of the trapezius muscle. As I've told you, the trapezius muscle has got 3 sets of fibers, or 3 sets of fibers. Okay, so we have this descending part. The descending part, when it contracts, it will elevate the scapula, correct? Yes, it will elevate the scapula. And then we have the ascending part. This is ascending part because it comes from the spine and it ascends to insert to the the superior border of the spinous process of the scapula. So when it contracts, it depresses the scapula. It depresses the scapula downward. Yeah, so that's the descending part. That's the ascending part of the scapula. Ascending part of the trapezius, sorry. And then it has got the middle part, the intermediate or the middle part. So when the intermediate part contracts, all the scapula, all the trapezius contracts together, it will retract. It will pull this scapula to the medial side, So it will retract the scapula, and of course you guys, because some of you are coming from military services, I hope you know that when a soldier becomes attentive, so they have to pull their chest out, and that action of pulling the chest out is gonna bring the scapula back in the medial, and that's also what's known as the retraction of the scapula. So the middle part of the scapula, the middle part of trapezius helps to retract the scapula, or when they are acting together, they retract the scapula. But something very interesting here, when the descending part and the ascending part contract together, they're gonna rotate the glenoid cavity superior. Why? Because see, they are inserting in this fiber, in this superior border of the spinous process. So when they are contract, they're gonna pull the spinous process into this direction. When they do so, they're gonna rotate this glenoid cavity superiorly, and they're gonna rotate the inferior angle of the scapula laterally. So all this defines the superior, the upward rotation of the scapula, What is the innervation of the trapezius? The trapezius muscle is being innervated by the cranial nerve number 11. I mean, we haven't talked about the cranial nerves at this point, but you can just keep it in your mind that it is innervated by the cranial nerve number 11, which is known as the spinal accessory nerve. Of course, this gives the motor fiber to the muscle, the motor fibers to the muscle to help it contract. But it also receives some spinal nerves, C3 and C4 spinal nerves, and this is for pain and the proprioception, the sense of joint position, I think you don't have any question on trapezius, and let's move to the second superficial muscle, which is latissimus dorsi. Latissimus dorsi, just from the name, we discussed the elements of myology, and I told you the latissimus defines the widest nature of a muscle. So latissimus dorsi is the widest muscle. Latissimus, which widest, dorsi, back. So it's the widest muscle of the back. So this widest muscle of the back has got a very wide origin as well. Okay, so it originates from the lower six thoracic vertebrae. You see the lower six thoracic vertebrae, the wool of the lumbar vertebrae, and the wool of the sacral vertebrae. Of course, also with this, the thoracodorsal fascia. So it originates from the spinous processes of the lower six cervical vertebrae, lower six thoracic vertebrae, the lumbar vertebrae, as well as the sacral vertebrae. Okay, and then it also takes origin from the superior iliac spine, and the thoracodorsal fascia. So that's the origin of the muscle of the latissimus dorsi. What is insertion? What is insertion of the latissimus? Of course, it also has the origin from this inferior angle of the scapula. So you see this reddish stuff over here. This reddish stuff over here is the is also inferior angle of the scapula. Also, it forms origin of the latissimus dorsi. You see it touches the inferior angle of the scapula. Alright, this muscle is going to insert into the floor of the intertubercular sulcus. It inserts into the floor of the intertubercular sulcus, or the so-called intertubercular groove. Intertubercular groove. I am telling this at this time for the first time that the latissimus dorsi inserts in the floor of the intertubercular sulcus. And we know that we have discussed it, that the intertubercular sulcus has got two lips. So it has the medial lip and the lateral lip, and between the medial and lateral lip, they attach the pectoralis major and the teres major muscle. For this reason, there is a special mnemonic for remembering the orientation, the insertion of these three muscles, which states that a lady between two major, a lady L for latissimus dorsi, which is going to insert in the floor, on the floor of the intertubercular sulcus, and it is between two major muscles, which is the pectoralis major and the teres major muscle. So this is for the first time. I will tell you next time and the other time as well. Okay. So that's the insertion of the latissimus dorsi in the floor of the intertubercular sulcus or intertubercular groove. Alright, so it's been innervated by thoracodorsal nerve. A thoracodorsal nerve, of course, we also discussed it when we are doing the brachial plexus. What is the action of the latissimus dorsi muscle? So latissimus dorsi has got action on the humerus, of course, at the part of the shoulder joint, but also it has some respiratory function or respiratory movement. So one of the respiratory movement is it acts as the accessory muscle of respiration. Okay, accessory muscle of respiration. As I've told you, we don't discuss the respiratory function at this point. We'll have a separate discussion on that one sometimes later. What about then the actions on the humerus? Okay, so you have to remember that this muscle inserts. It inserts on the humerus, on the intertubercular groove on the humerus. Okay, so when it contracts, it's gonna pull this humerus towards the midline. So when it contracts, it pulls the remember this muscle will not have one action. Why? Because every time you see the muscle insert through an angle, it's not like straight. So for example, this one is an oblique muscle, it's diagonal muscle. It makes a diagonal insertion. So the movements will always be complicated. I mean, you don't have a simple movement like, for example, adduction or just abduction or rotation and flexion and all that. So it is really complicated because it inserts through an angle. So it has like more than one movement or more than one action. And the very first action I can say is adduction, because when it pulls, if you resolve this force, it is in this and this direction. Okay, so it will adduct the humerus. So adduction is very first function of the latissimus dorsi muscle. But when it does adduction, it is also, remember, it is inserted on the intertubercular sulcus. Okay, so when it pulls, it's going to rotate. It's going to medially rotate the humerus. So medial rotation of the humerus is another function, is another action of the latissimus dorsi muscle. Medial rotation of the muscles. But see, it's also centered on the anterior surface of the humerus. So when it pulls, it's gonna flex. It pulls back the humerus. So the movement of the humerus backward is what? What is it called? That is extension. All right. So I think you guys are now aware about the three actions of the latissimus dorsi muscle. All right. So adduction, because you are pulling towards the midline, and of course that's an adduction. But because it inserts in this part, when it's pulled, it's going to rotate it's going to rotate the humerus medially. For example, when you want to scratch your the inferior border of the scapula by using your hand, so you're going to rotate. So that rotation that you're doing at this joint. Remember, it's not at it is not at the elbow joint. It is at the shoulder joint. Okay, it is the movement at the shoulder joint that counts. All right. So together with pectoralis major, the latissimus dorsi is the powerful adductor of the humerus at the elbow joint. And every time you are defining movement, you will have to tell us at which joint this movement makes its action. Okay. All right. So it also it's very important because this is a powerful adductor, which means it restores back the arms to the neutral position towards the body. So also when you are climbing, for example, this person over here, when you are climbing, so you want to pull yourself upward by, how you're gonna pull yourself is by lowering. You are pulling. It's like you are restoring back your arms into the midline, and by doing so your body rises. So for this reason, the latissimus dorsi muscle is also known as the climbing muscle. So it helps you to climb. That makes sense. So let's go into the deep group. Remember, the deep group had three muscles. We had the levator scapulae, and we had rhomboid major and rhomboid minor. The good thing about the deep group is that they have common innervation. So they share the common nerve supply. So okay, let's discuss about the levator scapulae muscle. So from the name, levator scapulae, what do you think this muscle does? Okay, this muscle elevates the scapula. And what's elevation of the scapula? Remember, like shrugging the shoulder, like you signify. I don't know. So that's elevation of the scapula, and it is done by the levator scapulae muscle and along other muscles. So where does it originate? You see where it originates. Remember, I've told you these muscles are originating from the spine and they are going to the appendicular skeleton. Okay, so they are taking their origin from the posterior tubercles of the transverse processes. So we have, you remember, the cervical vertebrae have got these transverse processes. So the very first four cervical transverse processes, they act as the origin of the levator scapulae muscles. So we have two levator scapulae muscles because we've got two scapula. Okay, so we have one on the left and one on the right, one on the left and one on the right. And where do these muscles go to insert? They are going to insert the medial border of the scapula, just superior to the spinous process of the scapula, superior to the spinous process of the scapula. That's insertion. And what is innervation? As I've told you, they have common innervation with the rhomboids, which is dorsoscapular nerve. A dorsoscapular nerve, we also see it when we're discussing the brachial plexus. And what's the action of this muscle? Number one, see, so I've told you, every time you see the muscle is inserting through an angle, not straight, it's going to be complicated. The movements are going to be complicated. So number one is elevation of the scapula, because when you resolve this force, you see that the part of the force will elevate the scapula, pull it upward, like shrugging your shoulders. But another action is to rotate the scapula. Okay, so when you're pulling this way, the scapula is going to rotate in this side, and of course that is known as the downward rotation of the scapula, as we have discussed the other time, the downward rotation of the scapula. And of course there are some other muscles that help also to laterally to inferiorly rotate the scapula. All right, so let's go into rhomboids. So we have two rhomboids, the rhomboid major and the rhomboid minor muscle. So this is the rhomboid major muscle and this is the rhomboid minor. These muscles are thin, they are just thin muscles. Okay, yeah, so they are obliquely inserted and they have the shape of equilateral parallelogram. So rhomboid, we discussed it at the time that rhomboid is a rhombus-like muscle. It's a rhombus-like muscle. It has a shape a little bit like a diamond. And these muscles, they are found, both the levator scapulae and the rhomboids major are found deep within the trapezius muscle. They are found deep within trapezius muscle. All right, so let's discuss each one in turn in terms of origin, insertion, and innervation. Okay, so origin of the rhomboid minor muscle. It's from the spinous process and the neutral ligament. The neutral ligament is the spinous process of T7 and the T1. So C7 vertebra and the T1 vertebral spine. Okay, what about the rhomboid major muscle? Is just below the rhomboid minor muscle. So it is originating from the spinous processes of T2 up to T5, T2 to T5. What about the insertion? What about the insertion of the rhomboid minor muscle? So the insertion of the rhomboid minor muscle is at this bluish part here. Remember I told you the reddish part is origin, the bluish part is the insertion. So the muscle that is inserting here is marked by blue. By blue. The muscle that originates from here, it is marked by a reddish a red painted area region. Okay, so the rhomboid minor muscle, it inserts on this medial end of the scapula, just medial to the spinous process of the scapula, the spinous process of the scapula. Okay, so there is smooth triangular region here. The smooth triangular region, you can see it inserts on this smooth triangular region, just the medial end of the spinous process of the scapula. Okay, what about the rhomboid major muscle? You see the rhomboid major muscle, it inserts just below the rhomboid minor muscle. So this bluish stuff that spans from all this, from the medial end of the spinous process all the way to this region, is the rhomboid major muscle. That is the rhomboid major muscle. So that's the origin of the rhomboid minor, and that one is the origin of the rhomboid major muscle. So the medial border of the scapula just inferior to the rhomboid minor muscle. What about the innervation of these muscles? What are the nerves supplied to this muscle? That's always easy because these two muscles have got the same innervation, which is dorsoscapular nerve, same nerves that innervates the levator scapulae muscle. So what's the action now of the rhomboid muscles? What is the action of the rhomboid muscles? So you have to bear in mind that these muscles, they are inserting at this point, at this point here. So the medial and the medial border, one superior, one inferior. But but you should also note that this muscle, they insert through an angle, so they are diagonal muscles. So what did I tell you about the diagonal muscles? They're going to complicate their movement. So they will always have a complicated movement. It's not a simple movement. If it could be, if this muscle could be like straight to the back, like these transverse muscles, they would just do one movement, maybe retraction of the scapula. But because they are inserting through an angle, the movements will always be complicated. So number one is retraction of the scapula. Are you surprised? No. What's the example of retraction of the scapula? Of course, when you're pulling something towards you, the scapula, they're gonna like approach one another. One on right, one on left, they're gonna approach one another. So that is retraction. So rhomboid muscles, they also help in retraction of the scapula. But that's not the only thing that they do, because they are pulling this they are pulling the scapula in this direction, so they also help a little bit of elevation, so elevation of the scapula as well. Okay, all right. So what about because they're also pulling from this, you see, they are pulling from this angle this way, so this will result into movement of the inferior angle of the scapula medially, but the glenoid cavity will go inferior. Okay, so the glenoid cavity will also go inferior. So what is that movement? That is downward rotation of the scapula. In the downward rotation of the scapula, if you refer the movements of the scapula, is that the glenoid cavity goes the glenoid cavity goes inferiorly, but the inferior angle of the scapula goes medially, and this is what happens here. This is what happens in the rhomboid muscle. Alright, so the serratus anterior muscle, which is a discussion sometimes later, it is an antagonist. It's the antagonist of these rhomboid muscles, and we see how the serratus anterior acts as the antagonist of these muscles, So together, this muscle, apart from all these special characters, together they stabilize the scapula, and by doing so, they are stabilizing the shoulder joint as well. So let's discuss about the surface anatomy of the back. All right, so we know that we have only two muscles which are superficial. And that is the rhomboid, the trapezius muscle, and the latissimus dorsi muscle. Only these two muscles superficial. And so for someone who does have muscular, for someone who is muscular, this muscle is gonna have prints on their back. Okay, so for example, this guy over here, you can see this is the trapezius muscle, and this one is the latissimus dorsi muscle. Okay, so maybe that is not very much important, but what is important is you see here, this is trapezius muscle, this is latissimus dorsi, and this one here is the medial inferior border of the scapula. They all together form something like a triangle here. So they form something like a triangle here. All right. So that's the inferior angle of the scapula. This is the this is trapezius muscle, and this is latissimus dorsi. So they form this triangular region over here, which is known as the triangle of auscultation. The triangle of auscultation. So sometimes in your exam, someone can ask you, what are the borders of the triangle of auscultation? So the borders of the triangle of auscultation, the medial border, so this is the medial border of the triangle of auscultation. The medial border is formed by the lateral border of the trapezius muscle. You are not surprised, okay? So the inferior border is made up by superior border of the latissimus dorsi muscle. Okay, latissimus dorsi muscle, and then there are the superolateral border. It is made up of the inferior medial inferior angle of the scapula. So why is it known as the triangle of auscultation? Of course, it's triangle as we've seen, but why auscultation? So auscultation is that listening of the internal organs, listening to the sound of the internal organs, especially using the stethoscope. Okay. So in the back, previously, this region here is less covered by muscles. It's the most it's the only point on the back that the lungs are very close to the skin. Why? Because it is not covered by many muscles as the other places. For example, so you see this is the scapula. Scapula has got 100 of muscles. I'm exaggerating, but it has got a lot of muscles. This is trapezius, which is also thick and deep within trapezius. There are rhomboids and all that, but this is also the latissimus dorsi, which is also a little bit thick. But only at this point, only at this triangle, there is a thin layer. It's not covered by a lot of muscles, and so the lungs are closest to the skin, and the listening of the lung sounds could be easy at this point, and this is why it is known as the triangle of auscultation. So it was clinically useful previously, but nowadays we know most of these stethoscope they've got this remarkable ability. The sensitivity is very high, so they can just listen everywhere. But previously they used to listen to this triangle of auscultation because the lungs were closest to the skin at those points. So of course, this point you have the spinal process of T7. So in case of question, additional comment, you can always write me an email, but don't forget to follow me on Instagram and TikTok and Neurosketch with Dr. Kenny. I also have a Telegram channel where I post these materials for those who cannot access the lecture notes. But I have a YouTube account, a YouTube channel, and a Neurosketch with Dr. Kenny. And don't forget to subscribe and hit the bell button for you to get notification once a new video is uploaded. So that's it from today's discussion. See you next time.